So I've had problems with my sinuses for a long time, probably since I was a kid. I have more congestion due to blockage in my sinuses that I need to correct. I started having migraines. So when I saw Dr. Thompson last, he said my left sinus is completely blocked, so that is probably what's triggering my migraines. And it does show in the CT scan that it's completely blocked.
Hi, my name is Dr. Christopher Thompson from Aspire Allergy and Sinus, and I'll be walking you through how our balloon sinuplasty procedure works. You can see me there on the right of our patient Brenda getting ready to start the procedure. At this point you can see she's already asleep, and I'm using some additional anesthesia to get the nose really numb, which allows us to use less of the anesthesia and still keep you completely comfortable. The doctor on the right is an anesthesiologist. We only work with anesthesiologists for our sedation, so we've got the best possible professional there taking care of you, making sure you're safe and completely comfortable throughout. You can see he's giving a little bit of pressure under her jaw just to make sure that her airway stays nice and open. We've got oxygen there going into her mouth. And she is completely asleep and won't have any recollection of the procedure. So at this point we turn the lights out because I'm initially passing a very small wire that has a light on the end of it through the nose and into the sinus, and that lighted wire allows us to confirm that we're in the sinus that we're planning to go into, so it gives us confirmation that we are where we think we are. And once the wire is in position, we can then thread a tiny balloon over that wire to go into the sinus. But what we want to do is target the sinus drainage pathway with that balloon so that when we inflate it, we're really enlarging only that part of the sinus which is responsible for drainage. This procedure is really remarkable, especially if you're aware of the predecessor to the procedure, which was a much more aggressive operation that typically was done in the hospital, was associated with a lot more bleeding, a significant recovery, and so that procedure, functional endoscopic sinus surgery, can largely be replaced by what we're doing here, which is the balloon sinuplasty. We're doing this in our office. We have it set up as an operating room, and we have all the equipment that an operating room would have, but we offer the convenience of being in the office so the patient doesn't incur the cost and all the rigmarole of going through the hospital. The whole procedure usually takes about 10 or 15 minutes. That handpiece allows me to vacuum out the sinus once the tip of the device is actually in the sinus, so I can vacuum any stuff out of there, and then we can also irrigate or put saltwater solution into the sinus and wash out the sinus. So kind of simultaneously put solution in and then vacuum it out at the same time if we want to clean the sinus out. It's nice because we're not cutting, we're not removing tissue. Makes for an easy recovery and a safer procedure, but still gives really good results in terms of significant improvement in nasal breathing. And there we are. Usually these procedures take between 10 and 15 minutes, and she'll probably be going home within the next 15 or 20 minutes. A little groggy, but usually ready to go get a meal and usually take a nap, and then ready for regular activities the following day.
I was congested for about 2 weeks, and after that I felt a lot of relief. I felt a lot more energy, the headaches went away, there was no more pressure, no more pain. The day of the procedure I went home, just kind of relaxed all day, just did minor ibuprofen for the pain, and the next day I went to work. And I felt good. So on a scale from 1 to 10 before my procedure, I would say my breathing was at a 3. And after the procedure, up until now, I feel out of 10. Like, it's so much better. If anybody is considering balloon sinuplasty, I recommend it 100%. It is definitely life-changing.